This is a University of New South Wales, Liverpool Hospital 2008 garlic sauce production. This video will be a short introduction on how to examine a shoulder joint. Today we have Carlos as the examiner and Peter as a patient. Okay, so to begin, you introduce the patient.
My name is Carlos. Do you mind if I examine your shoulders?
Explain the procedure.
Okay, Peter, so I'm just going to be moving your shoulders out and having a look at you. Is that alright with you? Yeah.
The first step is to ask the patient to undress, and in doing so, careful observation needs to be made for discomfort.
So Peter, could you please take your shirt off?
So assuming that that's been done, Carlos will now perform a general inspection, looking especially for rashes, erythema, atrophy, deformity, or any scars from previous operations. Assuming that is done, Carlos will now move on to palpate each of the important joints in the shoulder girdle. This involves the sternoclavicular joint, the acromioclavicular joint, and the glenohumeral joint.
You got any pain there?
No. After this has been done, we now ask the patient to do the Apley's scratch test.
Okay, Peter, so pretend you've got a scratch on your right shoulder. I'd like you to begin by scratching it like this, okay? And then from above, and then from below. Okay, that's good. And then we'll go to the other shoulder, so like this, from above, and from below. That's great.
The Apley's scratch test is a common screening tool used to look for the major movements of the shoulder joint. The next step now is to ask the patient to do some active movement of the shoulder joint.
Alright, so we'll start with our palms forward, Peter. And can you just copy me with my movements? So we'll go all the way up forward, then all the way back, as far back as you can go, then go back to zero, and go all the way sideways, and forward. And then could you bring your hands like this and go just as far as you can. And then can you just go behind your back and then go bring your thumb as high as you can, and the other one please. Okay, thank you.
The next part of the examination involves passive movement of the shoulder joint. Of particular concern when you do this, you must have your hand on the joint, feeling for crepitus, looking at the range of movement, and looking for any discomfort or pain that the patient experiences.
Alright, Peter, so could you please, I'm just going to move your arm for you this time, up, and all the way back, good, and this way, up, and all the way back. There's a click in the right shoulder as he flexed his arm. Okay, Peter, so we're going to go sideways this time, so all the way up, and then in as well, good. Arm forward please, yep, all the way up. And all the way. Okay, we're down to external rotation, so could you please, and then go up. I'm going to pull this one out, and this one out as well. There's no pain there. And then we're going to test the internal rotation, so could you please bring, and I'm going to push your thumb up as far as I can go, and the other one please. Okay.
The next step now is to test the muscles of the rotator cuff. The first muscle we test is the supraspinatus, which abducts the shoulder.
Alright, so could you bring your right shoulder up like this and put your thumb down and keep it up against my hand. Good. And this one. So 45 degrees and keep it up. Okay, good.
Next, we test the infraspinatus and teres minor, which both laterally rotate.
Okay. So can you push your arms out against me as hard as you can? Good.
The next muscle group is your subscapularis, which medially rotates the arm.
So Peter, you put your hand there, can you push against my hand as hard as you can? That's the lift-off test. And as hard as you can, do it again. Excellent.
Once the rotator cuff muscles have been tested, we now test for supraspinatus tendinitis.
I'm going to put my hand here on the supraspinatus tendon, and tell me if there's pain as I extend your arm.
No.
No? Okay, so by doing this, I'm bringing the supraspinatus tendon that will come against my finger and will cause pain into the tendonitis. That's at the same time after this, I'm going to ask Peter to flex his arm and push against me.
This is testing for the biceps.
And this one. Good.
The last thing we do is to test for apprehension.
Okay. So Peter, could you please get your shoulder to do this? Yep. I'm going to come behind you. I'm going to push on your shoulder forward and pull this back. Is that painful for you? No. Okay.
Carlos is testing anterior dislocation, of which 95% of dislocations are anterior.
Okay, Peter, so could you please put your left shoulder like this and bring it forward like that? And I'm just going to push forward there.
Carlos is now testing posterior dislocation, which accounts for 5% of dislocations.
Okay. This completes the shoulder exam. I'd like to now finish by examining Peter's neck, axilla, neurovascular status of the arm and his elbow as well.
This concludes our production for 2008 on the shoulder examination. Thank you very much for joining us, and we hope to see you in other videos in the future.
And can we just say thanks to Deep?
Special thanks to Deep and Dinesh, and Murat, who's our cameraman, who provided the garlic sauce.